Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. And I'm afraid, let's try this. There we go. Please bear with us as we continue to experiment with this new format. Please realize these videos are not intended to replace visits to your physician. They are intended to educate you. If we can help you here in our office, if you have specific concerns, please give us a call at area code 775-359-7111. We'd be more than happy to see you here same day. But we really can't help you over the internet. That's not good medical care. What we want to talk about today, realistically, is what is a pediatrician? Where do we come from? Who are we? And why would you want to bring your kid to see one of us? There seems to be a lot of myths out there about what our background is, so let's demystify that a little bit. We start by going to college like everybody else in medicine. Physicians can major really as undergraduates in anything they want. Most of us major in biology, biochemistry, molecular biology, something like that. But I certainly have classmates who are excellent physicians who majored in marine biology, classmates who majored in literature, majored in violin performance. In the case of a good friend of mine from med school, who was a brilliant violinist. Journalism, English lit, the list goes on and on. Poetry, the list goes on and on. During that time, though, all pre-medical students take certain prerequisite courses. And I'm not going to go down the whole list of prerequisites, but includes chemistry and organic chemistry and some biology and math and science stuff. We then apply to medical school. Everybody goes to the same kind of med school. Everybody's general program is the same. Roughly the first 2 years are spent in a classroom, and we study all the basic sciences. So we study biochemistry and anatomy and microscopic anatomy and pathology and pharmacology, drug therapy, psychology, psychiatry, blah, 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 blah. The last 2 years we then spend, and pretty much everybody does, at least the third year everybody's is pretty much the same. We rotate through all the core areas of medicine. So all physicians spend a certain amount of time rotating through obstetrics and gynecology, general pediatrics, general internal medicine, family practice, neurology, surgery. At the end of all of that, we then do our fourth year, and a lot of our fourth year winds up being elective materials. After that, we then do our residency, and that's what makes pediatricians pediatricians. So to be a general pediatrician, our residency is 3 years long. It is dedicated to general pediatrics. We do not study adult medicine. We do not study surgery during this time. We study only pediatrics. We rotate through all core areas of general pediatrics, including the pediatric outpatient, the pediatric intensive care unit, the pediatric ward, and the newborn intensive care unit, as well as the normal newborn unit. And we rotate through specialty areas as well. So gastroenterology, hematology, oncology, pediatric neurology, the list goes on and on, cardiology, etc. During this time, we actually take care of our own patients, and we function as junior physicians, but we actually have our own patient panels and our own area of responsibility. At the end of that, we're then qualified to sit for an exam known as the board certification exam from the American Board of Pediatrics, and then we can be certified as general pediatricians. As such, we work in this industry. We have 3 years training dedicated to the care of only children. We do not spend any of our residency training learning how to care for your grandmother's heart attack, deliver babies, or pretend we can operate. We leave operating to surgeons. We leave delivering babies to obstetricians, experts in delivering babies, and caring for your grandmother's heart attack to ER doctors. As a general pediatrician, we are required to rotate through certain areas. We must spend a minimum of 1 month training in developmental pediatrics. And we're the only people who train in that field. We must do a minimum of 1 month training in adolescent medicine. We must do a minimum of 2 months training in emergency room, at least 1 month of which must be in a pediatric emergency room. And again, we're the only people with that requirement. In addition to all of the other stuff that we do. To be a pediatric specialist, a pediatric cardiologist, pediatric pulmonologist, pediatric emergency room doctor, etc., after finishing your pediatric residency, you can then apply for an additional 3-year fellowship in one of these areas and do an additional 3 years of training, essentially doubling your education, and take an additional board certification exam, so the subsection on pediatric pulmonary medicine, etc. Pediatric emergentologists, by definition, are general pediatricians first, emergency room doctors second, but they have 3 years dedicated training to caring for children in the emergency room. That was after 3 years dedicated training to caring for children in general. But don't ask them to take care of your grandmother's heart attack. They're very good at what they do for your children, and I love working with them. Almost became one because I enjoyed it, but if I had become one, I wouldn't be able to take care of your grandmother's heart attack either. So I hope this helps you to understand what it is we do and where we come from and the limitations of our training. We're not psychiatrists. We're not child rearing specialists. Most of what we know about rearing children come from our own reading and our own children, so it's on-the-job training. But all we do all day long is care for kids, and we'd like to think we're pretty good at it. I hope this helps you understand us a little bit better. If we can be of any help here at our office, give us a call, 775-359-7111. We'll see you next week.